Okay, so now I'll discuss about the next drug, that is the cyclophosphamide. Again, a very important drug, cyclophosphamide. It is also a it's a nitrogen mustard. General cytotoxic action of this drug is similar to that of other alkylating agents. What is that? What are the therapeutic uses? Because it's an alkylating agent as well, so you know the mechanism is going to be the same. And therapeutic uses, cyclophosphamide, when it is administered orally or intravenously, we found that single agent, if we give a daily oral dose of 100 milligram for 14 days, has been recommended as adjuvant therapy for breast cancer. So cyclophosphamide is a very good adjuvant drug for the breast cancer therapy, and for patients with lymphomas and chronic lymphocytic leukemias. This is also very useful drug. Higher doses of 500 milligram intravenously every 2 to 4 weeks in combination with other drugs often is employed in the treatment of breast cancer and lymphomas. Gastrointestinal ulceration, cystitis, and less commonly pulmonary, renal, hepatic, and cardiac toxicities. Uh, Gastrointestinal ulceration, cystitis, and less commonly pulmonary, renal, hepatic, or cardiac toxicities. So these kind of toxicities are caused by these drug, hemorrhagic myocardial necrosis. Okay, may occur after high dose therapy with total dose of above 200 milligram per mg. So you can see in most of the case, I told you that if you are giving any these drugs in the high doses, it's going to cause the serious adverse reactions. So we have to take it very seriously while we are selecting the doses. It is an essential component of many effective drug combination for non-Hodgkin lymphomas, ovarian cancers, and solid tumors in children. You remember these name of these cancers we have discussed before, that these are the cancer can be cured in children. Complete remission and presumed cure have been reported with cyclophosphamide was given as a single agent for Burkitt's lymphoma. It frequently is used in combination with methotrexate and fluorouracil as adjuvant therapy after surgery for carcinoma of the breast. So, a good agent to get in combination with the methotrexate. Because of its potent immunosuppressive properties, cyclophosphamide has been used to prevent organ rejection after transplantation. One more additional feature I'm discussing about this drug. It has a potent immunosuppressive action, right? Because of its immunosuppressive action, this drug can be used in the cases of organ transplant, where you need to silence the immune system of the patient. Okay, so next drug here is nitrosoureas. Next class is nitrosoureas. Nitrosoureas appears to function by cross-linking through alkylation of DNA. So what it is going to do? It acts on cross-linking through alkylation of DNA. The drugs may be more effective against plateau-phase cells than exponentially growing cells. So particularly this drug is more effective on the plateau phase drugs, right? Not with the exponentially growing cells. Though within a cycling cell population, these agents appear to slow cell progression through the DNA synthetic phase. They are acting on DNA synthetic phase, means S phase in the cell cycle. Because of its ability to cross the blood-brain barrier, carmustine is used with procarbazine in treatment of malignant gliomas. Very important point here. You can understand that carmustine is used with the procarbazine in the treatment of malignant gliomas. Nausea and vomiting, leukopenia, thrombocytopenia, and rarely hepatitis are adverse effects of lomustine and carmustine. Okay, now I'll talk about the pharmacokinetic of this drug, nitrosoureas. The nitrosoureas are highly lipid soluble and crosses the blood-brain barrier, making them useful in the treatment of brain tumors. Why it is useful in the gliomas, as I have discussed before? Because it is highly lipid soluble and crosses the blood-brain barrier. Okay. After oral administration of lomustine, peak plasma level of metabolite appears within 1 to 4 hours. So you can easily achieve the peak plasma concentration. Urinary excretion appears to be the major route of elimination from the body. One naturally occurring sugar containing nitrosoureas, streptozotocin, is interesting because it has minimal bone marrow toxicity. Now, initially also I have discussed about this particular drug. Streptozotocin is a cytotoxic drug, but it don't have the bone marrow toxicity. It causes the toxicity on other organs, by which it is become important for diagnostic purpose. I'll tell you. This agent has activity in the treatment of insulin secreting islets of cell carcinoma of the pancreas. Means if there is a pancreatic tumor, so this drug is very good. It go and kill those tumor cells. But if you give it to the normal person, even though it kills the cells of the pancreas, right? And that's what the reason. Once you give it to the normal person, it causes the damage of the beta cells of the pancreas, and it causes the person as a diabetic. And for this property, we utilize the streptozotocin for inducing the diabetes in the rats when we want to test our anti-diabetic drugs. Okay. So what are the that's why I'm discussing only the toxicity of STZ here. That's what purpose it is utilized. Nausea is frequent, mild, irreversible renal or hepatic toxicities. In less than 10% of patients, renal toxicity may be cumulative with each dose and may be fatal. Streptozotocin should not be given with other nephrotoxic drugs. You can see along with this it causes a lot of nephrotoxicity. So it's not preferred to join with the other nephrotoxic drugs. Okay. Hematological toxicity, anemia, leukopenia or thrombocytopenia occurs in 20% of patients. Next drug is here is methyl hydrazine. The drug name is procarbazine, methyl hydrazine class. Procarbazine is an orally active methyl hydrazine derivative. It is used in combination regimens for Hodgkin's, non-Hodgkin's lymphomas as well as the brain tumors. It inhibits DNA, RNA and protein biosynthesis, prolongs interphase and produces chromosome break. Oxidative metabolism of this drug by microsomal enzyme generates procarbazine and H2O2, which may be responsible for DNA strand scission. Getting my point? It inhibits DNA and RNA protein biosynthesis, prolongs interphase, and produces chromosome break. Oxidative metabolism of the drug by microsomal enzyme generates azoprocarbazine and H2O2, which may be responsible for DNA strand scission. So you can understand how the DNA strand is breaking down by the formation of azoprocarbazine. Right. A variety of other metabolites are formed that may be cytotoxic. One metabolite is a weak MAO inhibitor, right? You remember your second year what called the adrenergic system. There you will remember the MAO inhibitors. With the sympathomimetic, tricyclic antidepressants, antihistamines, CNS depressants, antidiabetic agents, alcohol, and tyramine containing food. So it is a weak MAO inhibitor. So we are combining it with other MAO inhibitors to potentiate the effect. There is an increased risk of secondary cancers. It is more carcinogenic than other alkylating agents, right? As I told you, the alkylating agents themselves are prone to do the mutation and cause the cancers, different kind of cancers. So here also it is one of the that kind of drug. Next class is triazines. In this, the drug is DTIC, decarbazine. Dicarbazine is a synthetic compound, forms metabolite which is monomethyl derivatives. This metabolite spontaneously decomposes to diazomethane, which generates a methyl carbonium ion that is cytotoxic. What is happening? Dicarbazine decomposes to diazomethane. What is this? It's a diazomethane compound which is actually generating a methyl carbonium ion, right? And you know that carbonium ions are the cytotoxic agents. It is administered parenterally and it is used in the treatment of malignant melanoma, Hodgkin's lymphoma, soft tissue sarcomas, and neuroblastomas. Main dose limiting toxicity is myelosuppression, but nausea and vomiting can be severe in some cases. Here, as I am progressing into these drugs, the common features are means already discussed before. So I am only discussing the important features of these classes of other drugs. Next is the alkyl sulfonates. Example is busulfan, again very important drug. It produces little effect on lymphoid tissues and GIT. In high dose regimens, pulmonary fibrosis, gastrointestinal mucosal damage, and veno-occlusive disease of the liver become important. Now we'll discuss the therapeutic uses of busulfan in treatment of chronic myeloid leukemia. The initial oral dose of busulfan varies with the total leukocyte count and the severity of the disease. What does it mean? It is you are using it for chronic myeloid leukemia. So initial oral dose, what you are fixing for the busulfan dose, that depends on the person's total leukocyte count and the severity of the disease. So first we have to check it out the leukocyte count, and then we have to decide the severity of the patient's disease, and then we have to choose the busulfan. Daily dose from 2 to 8 milligram for adults, that is and 60 gram per kg for children are used in initial therapy. High dose of busulfan can be used effectively in combination with high doses of cyclophosphamide to prepare leukemia patients for bone marrow transplantation. It means what? For any cancer patients where the bone marrow transplantation is being advised, so busulfan is a one good combination drug for the cyclophosphamide. So we combine the cyclophosphamide busulfan together and to use it for that purpose. Anticonvulsant must be used concomitantly to protect against acute CNS toxicities, including tonic-clonic seizures, which may occur several hours after each dose, because this drug has the reach to the brain. In that way, it can cause certain kind of mental disorders. So anticonvulsant can be given before, because it has a tendency to cause tonic-clonic seizures. Busulfan induces the metabolism of phenytoin. So lorazepam are recommended as an alternative to phenytoin. So lorazepam can be given here. So there are some clinical toxicities, myelosuppressive properties and prolonged thrombocytopenia. Nausea, vomiting, diarrhea can be experienced. Impotence, sterility, amnesia, fetal malformation. These all can happen in the long-term use. Asthenia, hypotension, syndrome resembling Addison's disease can also be formed. Rarely it happens. High dose busulfan causes veno-occlusive disease of the liver, seizure, hemorrhagic cystitis, permanent alopecia, and cataracts. The coincidence of veno-occlusive diseases and hepatotoxicity is increased by its co-administration imidazoles and metronidazoles. Okay, so by this we can end up this class of the drug alkylating agents, and now you have some other drugs as an assignment for you. When you will come back to the college, I will see these assignments in your notebook. Chlorambucil, melphalan, thiotepa, meclorithamine, cisplatin, and carboplatin.